How long have you been going through depression? Is it months? Are you going through depression now for years? Till you are now at the point where you have accepted that this is just who you are and this is just your life. You have embraced the life of depression. But my question is to you today. Are you ready for the change? Are you ready to live purposefully again? Because if you are not ready, there is nothing that a church can do, that a psychiatrist can do, or that anyone else around you can do. You have to reach at the point where you want this change, where you are tired of the life of a depressed. If you are ready, join me on this journey in understanding how to get over depression. See you. In order to fully overcome depression, we have to first understand the different factors that affect people in general. So the first one would be biochemistry, is where the brain is not producing enough chemicals to, and what's the name of it? Endorphins. Endorphins. Yeah, that's the name, endorphins. Where the brain is not producing enough endorphins, and these are chemicals that will allow you to experience pleasure, to experience joy, right? And they're experienced when they are produced when we do certain things, certain activities, right? So if you go to a psychiatrist, they will be able to provide, they will be able to prescribe medications that will be able to help you to produce these chemicals, to help to trigger the brain to produce these chemicals, so you will feel much better, and it will over a period of time enable you to overcome depression. Genetics, they say, play a part in depression as well. So they use the example of, say you are a twin and your twin was depressed. 80% of the time the other twin becomes depressed. I really don't know how factual that is, but they say genetics play a part. They also say that personality plays a part in it. They say that people who generally have a low self-esteem, who tends to worry a lot or worry easily, tends to be depressed easily. So your personality plays a role. And also environmental factors play a role in you becoming depressed, whether it be your current situation, poverty, or an ongoing abuse that you are experiencing, or an abuse that you have experienced and you have not gotten over it. So they're saying that these environmental factors can cause one to be depressed. According to authors, they say there are 3 ways in which you can overcome depression. And the first one would be medication, that I said before that a psychiatrist can prescribe for you. Medication. The next one would be therapy, where you go to a certified psychiatrist or psychologist, and then they will be able to walk you through this recovering process by using certain theories. For example, you can use the cognitive behavioral therapy is used as well, CBT, the psychodynamic therapy, and also the interpersonal therapy, IPT, are used as well to help the individual to understand themselves, understand the way they think, and to be able to make personal changes. And the last one in overcoming depression would be you. And this one is the most important one, because a psychiatrist cannot, no matter what therapy they use, it depends on the individual if he or she is ready for a change. So counseling is dependent, the success of counseling is dependent on the individual. And that was why I started off by asking you if you are ready for that change. Because the only way you can experience that change is unless you want it. So the third one in overcoming depression, personal treatment. And I know many persons will tend to opt for this because it is cheaper and you don't have to pay any money to go to the psychiatrist or counselor, and you don't have to pay the money to get no medication and all of that. So you would want the personal treatments. But personal treatment sometimes tend to be hard when you do it on your own. But these are the steps in overcoming depression on your own. Stay tuned. Welcome back. Yeah, are we at a better place now? You're feeling a little better? Are you? I hope you are feeling a little better than when you started out watching this video, because you are getting the information on how you're feeling, and I know you're doing introspection just to see if you are really depressed or it is just sadness you are feeling. And now we are at the point where you will be able to administer self-help in getting yourself out of depression. If you want to administer personal treatment, you have to watch the next video. Stay tuned and catch you there.